Hello everyone, wherever you are in the world. This is Tabish, and today we are diving into the crucial decision of selecting the right IV fluid, whether it's normal saline, NS, Ringer's Lactate, RL, or Dextrose, D5. We'll break it down for you, slide by slide, step by step. Let's jump right in. Slide 1. Introduction. This slide introduces the critical decision-making process in choosing the appropriate IV fluid. The core message is that selecting the correct IV fluid, whether it's normal saline, NS, Ringer's Lactate, RL, or Dextrose 5%, D5, is essential for effective patient care. The slide emphasizes the importance of tailoring IV fluid choices to meet specific patient needs, as the right selection can significantly impact patient outcomes. Slide 2. Introduction to IV fluids. 1. Essential for patient care. IV fluids are crucial in the treatment and management of various medical conditions, such as dehydration, electrolyte imbalances, and the maintenance of blood pressure. They play a fundamental role in patient care, particularly in acute settings. 2. Impact on patient outcomes. The choice of IV fluid directly influences patient outcomes. Understanding the specific uses and limitations of each type of fluid is essential to ensuring the best possible care and preventing complications. 3. Clinical settings. IV fluids are used across a range of clinical settings, including hospital wards, emergency rooms, and intensive care units, ICUs. This wide applicability underscores the importance of selecting the right fluid for each scenario. Slide 3. Basic physiology of body fluids. 1. Intracellular fluid. ICF refers to the fluid inside cells, making up about 67% of the total body water. It plays a critical role in various cellular processes, such as maintaining cell shape, enabling enzymatic reactions, and facilitating the exchange of nutrients and waste. 2. Extracellular fluid. ECF exists outside of the cells and includes plasma, the liquid component of blood, and interstitial fluid, the fluid surrounding cells. ECF is vital for transporting nutrients to cells and removing waste products from cellular metabolism. 3. Fluid shifts. Fluid shifts refer to the movement of water between the ICF and ECF. This movement is primarily influenced by electrolytes, especially sodium. Proper balance of these fluids is essential to maintaining physiological stability and preventing conditions like edema or dehydration. Slide 4. Types of IV fluids. 1. Crystalloids and colloids. IV fluids are broadly categorized into two types, crystalloids and colloids. Crystalloids. These are solutions with small molecules that easily pass through cell membranes. They are commonly used for volume expansion and correcting electrolyte imbalances. Examples of crystalloids include normal saline, NS, an isotonic solution with 0.9% sodium chloride, used for resuscitation in cases of hypovolemia, shock, and sodium replacement. Ringer's Lactate, RL, a solution resembling plasma, containing sodium, potassium, calcium, chloride, and lactate, often used for surgical patients, trauma cases, and correcting metabolic acidosis. Dextrose solutions, example D5W, D10W solutions providing free water and energy, primarily used for hydration and managing hypoglycemia, but they do not contain electrolytes. Colloids. These are solutions with larger molecules that remain in the intravascular space longer than crystalloids, making them ideal for volume expansion in more severe cases. Examples include albumin and heter-Stark solutions. Slide 5. Normal saline, NS. 1. Uses. NS is primarily used for resuscitation in cases of hypovolemia and shock. It's also used for sodium replacement and during blood transfusions because of its isotonic nature, which minimizes the risk of fluid shifts that could disrupt blood cells. 2. Precautions. While NS is widely used, it can cause hyperchloremic metabolic acidosis, a condition where chloride levels become too high, leading to an acid-base imbalance. Additionally, there's a risk of fluid overload, especially in patients with heart failure or kidney issues, so monitoring is essential. Slide 6. Ringer's Lactate, RL. 1. Uses. RL is often the preferred fluid for surgical patients and trauma cases. It is particularly effective in correcting acidosis because lactate, one of its components, is metabolized by the liver into bicarbonate, which helps to neutralize acid in the blood. 2 precautions. RL should be avoided in patients with severe liver disease because their liver may not metabolize lactate effectively, potentially leading to a buildup of lactic acid. Additionally, RL contains potassium, so it's not suitable for patients with hyperkalemia, elevated potassium levels, as it could exacerbate the condition. Slide 7. Dextrose solutions, D5-D10. 1. Free water and energy. Dextrose solutions provide both hydration and a source of glucose, energy, for patients who are unable to eat or drink, supporting their energy needs and preventing catabolism, the breakdown of body tissues. 2. Hypoglycemia management. Dextrose solutions are used to correct low blood sugar levels, hypoglycemia, particularly in situations where patients cannot maintain their blood glucose levels through normal eating. 3. Precautions. Dextrose solutions are not suitable for volume resuscitation because they don't stay in the intravascular space long enough to expand blood volume effectively. Additionally, they pose a risk of hyperglycemia, especially in diabetic patients, so blood glucose levels must be monitored. Slide 8. Choosing the right fluid. 1. Electrolyte status. Before choosing an IV fluid, it's important to assess the patient's electrolyte levels, including sodium, potassium, and calcium. The fluid chosen should help correct any imbalances while avoiding potential complications. 2. Volume needs. The patient's volume needs must be determined based on factors such as dehydration, blood loss, or other conditions that might require fluid replacement. This will guide whether to use a fluid primarily for volume expansion or maintenance. 3. Underlying conditions. Consideration must be given to the patient's underlying health conditions, such as heart failure, renal impairment, or liver disease, as these can affect how the patient responds to different types of IV fluids. 4. Clinical goals. The goals of fluid therapy should be clearly defined. Whether the aim is to maintain hydration, resuscitate a patient, or correct an electrolyte imbalance, the fluid choice should align with these goals. Slide 9. Common IV fluid combinations. 1. DNS. Dextrose normal saline. DNS combines D5W with normal saline, providing both free water and electrolytes. It's used in situations where both energy, from glucose, and electrolytes need to be replenished. 2. Lactated ringers with dextrose. LRD. This is a combination of ringers lactate and D5W, offering both electrolytes and energy. It's useful in scenarios requiring both metabolic support and volume expansion. 3. Half normal saline, 0.45% NaCl. This hypotonic solution is used for hydration and sodium replacement. It's often combined with dextrose to provide energy while addressing hydration needs in patients who don't require a full isotonic solution. Slide 10. Key points to remember. 1. Patient assessment. Always begin by assessing the patient's specific needs, including their current health status and any contraindications for certain fluids. This assessment is critical for safe and effective fluid therapy. 2. Fluid properties. It's important to understand the properties and appropriate uses of each type of IV fluid, including the differences between crystalloids and colloids, to make informed decisions. 3. Monitor closely. Once an IV fluid is chosen and administered, patients should be closely monitored for signs of fluid overload, electrolyte imbalances, and any adverse effects. Regular monitoring helps prevent complications and ensures that the fluid therapy is effective. And that's a wrap. Thank you for joining me. Subscribe to our channel, Tabish Akhtar Live, and get 1% better each day. Stay safe and keep learning.